Hello and welcome. My name is Dr. Clarissa Beiting, and this is Kim Martinez, and we are going to today talk about your post-op instructions and recommendations after any kind of major gynecologic surgery, including could be hysterectomy, any bladder prolapse surgeries, or treatment for incontinence surgeries. So we're just going to go through all the different recommendations on activity, limitations, restrictions, and even care. So we'll just jump right to that. First, we'll talk about activities and lifting. So, Kim, what would you tell patients would be the best way to limit their restrictions on lifting?
So the first 2 weeks, it's going to be super important not to lift anything greater than 10 pounds. So if you can imagine a jug of milk. And that won't be lifting something from the ground up onto a table. That would be lifting something out of the fridge and maybe setting it on the counter. Super important that no heavy lifting during your 6 to 8 week recovery time. After the 2 weeks, you will most likely have a virtual post-op, and we'll see how you're doing, and you can increase your lifting by a few pounds every week as tolerated.
Yeah, I find that usually by about 4 weeks or so, most people are probably up to at maximum like 15 to 20, but you don't want to overdo it. I think the main reason why you don't want to overexert yourself is you can get small herniations, even in the incisions, or you can have some slow healing in that vaginal cuff area. So that's kind of why we like your lifting restrictions. Okay, next, let's talk about exercise, Kim.
Yeah. So there should be no exercising during your post-op period. Walking as tolerated the first couple of weeks around your home, on your property, again, as tolerated is okay. And you can increase walking after 2 weeks if everything is well. We don't want you going to an exercise class or getting on an exercise machine. It is very important to take it easy, rest, and change position frequently. You don't want to be standing for an hour or more at a time. That can create a lot of pressure in the pelvic area and impede healing.
Yeah, I'll talk about that too. So exercising, I've told some patients, especially if they're really fit, they may even have like a 5-pound arm rate. If you're sitting in a chair, you can kind of get some mobility with just a very light weight as well. But for our runners, horseback riders, you really have to wait until that last, probably more like your 8 weeks for those super high impact exercises. Next, we'd talk about stairs. This is a very common question.
It really is. Most people do have stairs. They're worried about when they get out of their vehicle, stairs up into their level part of their home. And we tell patients stairs are okay. Just try to minimize the stairs. You don't want to be going up and down all day long. If you do have a bedroom on the top floor, maybe if before surgery, you can move some things down to the main floor to make things easier for yourself, so you're not having to go up and down all day long. But stairs are okay, and it can increase them as you are recovering.
Yes, I think that's important to know. I think a lot of people are hesitant to schedule surgery because their house may have stairs. But yeah, like Kim said, one step at a time, and just limit the number. And as the 2 and 3 weeks pass, you can usually do pretty well stairs normally. So next about driving, Kim. So.
That's a big one. People always ask about driving. They're very concerned about that. So we say for larger surgeries such as hysterectomy, we really like you to wait at least 2 weeks for driving. Now, if you think about when you're driving, if something were to happen, you would brake suddenly, or you might jerk and look over your shoulder and get that seatbelt. It could pull on you.
Yeah.
That could cause damage. So we certainly, or increase your pain. So we certainly don't want you driving for the first 2 weeks with a larger surgery. The smaller surgeries, we could say about a week. And again, we can kind of go over that in the appointment depending on the exact surgery, but you can be a passenger. Please, no long car ride. That's super important. We get asked this all the time. Can I take a long trip? Please check and call with us. We know emergencies come up, something may happen, but if you do have to travel in any form, please contact us first.
Yeah, and a lot of our patients will drive, 2 hours, 3 hours to get to surgery. So of course that's perfectly fine if you need to get home after surgery. And most of that is with driving too, when you turn and move normally, you just want to be careful that your reflexes seem normal, that you won't get into an accident. So that's kind of the rule of thumb on driving.
Oh, yes, and if you take narcotics, you want to wait at least 24 hours after the last narcotic pill before driving because it can impair judgment.
That's right, yeah, narcotics, good point there. So that leads us into pain control post-op. So let's go through what kind of options do we have for pain control?
So if it is safe for you, we do highly recommend taking anti-inflammatories, non-steroidal anti-inflammatories like Tylenol and ibuprofen. As you might alternate for a fever, you can alternate for pain control. So again, if you don't have any kind of health condition that would prohibit you from taking one of those, we do recommend that. And for the big surgeries, we can do stronger narcotic.
Yes, and I think the way I find it really useful is if you are able and if your kidney function's been normal, you can take an ibuprofen type medication, say breakfast, lunch, and dinner, maybe 3 times a day, every 8 hours. And usually only the days like 1, 2, 3, or usually it's less than 5 days, so you would need it that often even. And then you can alternate even a plain Tylenol in there as well, like an over-the-counter dose. A 325 up to, or even a 650 if you feel like you need a little bit higher dose on the Tylenol. And the narcotic, that would be for breakthrough pain. And not everybody needs narcotic type medications for their post-op care, but we do provide that for you should you need it. The things you want to be careful with narcotics are they can cause you to be very sleepy, can have impaired judgment, and you want to be careful to take them as directed. So we will go through those specifically at your appointment.
Yeah, and we always tell people as well that you may have a narcotic prescribed to you, get home and try it, it doesn't work, and that's okay. Just please call and let us know. I always tell patients as well to usually take a little snack with it, because it can, if you take it on an empty stomach, can make you very sick.
Yes.
So we certainly don't want you throwing up when you take that.
Yes, I find a lot of people do tend to have nausea and vomiting with narcotic medications. That's why it's nice to have other alternatives. And going on next is the bowel movements. And prevention of constipation is very important, especially with narcotics. If you're having a particular surgery where you feel like you need more narcotics, we need to be very careful to get your stools nice and soft. So Kim, what kind of options for stool softeners do we have?
So we often Dr. Beiting will prescribe something called Colace, which is an oral medication that you take that will help soften the stool and help make it easier to have a bowel movement. Another option is Miralax that you can mix with a water or a drink juice, and that will help kind of add through fiber to the diet and help pass stool as well. Increasing your water intake is so important for healing. Getting up and moving as tolerated. After surgery, we tend not to want to move around as much, and we're kind of afraid of pain, but really moving can help move the bowel, actually can help decrease pain. So getting up and moving as much as you can, taking these prescribed medications that she gives you, and increasing water intake. And some certain foods and vegetables do help as well. Most patients maybe have an idea, like if I eat this or drink that will help.
Yeah, I find that stool softeners, yes, a lot of those are over the counter, the Colace, and I find like if you know your surgery's upcoming, to go ahead and start the stool softener maybe a week or two before if you're not already pretty loose, because it's if you wait until like the day before, sometimes you've already kind of having some issues there. So Colace and Miralax are both over the counter as well, but we do provide those as prescriptions if you need. So. But those are both good. So let's talk about if patients have had nausea and vomiting with the prior surgeries, like what kind of things can we do to help them with that?
Okay, so I find that patients have told me in the past that keeping something on their stomach usually does help prevent some nausea. So just very light, gentle foods are highly recommended. And again, taking something with medicine as well, so that you're not taking it on an empty stomach. If you feel that you still have nausea, then please call, and Dr. Beiting can prescribe medication to help with that. Some patients know ahead of time, like last time I had surgery, I got very nauseous. Please let us know that before surgery, and she can help you with that.
Yeah, I'll go ahead and prescribe some. Usually we use ondansetron or Zofran. It's not as sedating, so we don't worry about too much sedation after surgery. Another thing we can do is a scopolamine patch, which you can use for seasickness or getting nauseated in car rides. So sometimes we'll have patients use that the night before surgery. And so just let us know if you feel like you've had problems with post-op nausea, vomiting before. Let's talk about pelvic rest recommendations.
Yes. So this is a very, very important point of recovery for any of our surgeries is pelvic rest, meaning that we need to prevent infection. We need to prevent harm to this recovering site. So for 2 months after your surgery, nothing in the vagina. No tampon, no douching, and no intercourse. That's very important, again, to help prevent any trauma to the surgery site and to prevent infection. Another thing is no submersion in water. Showers are permitted when you return home from the hospital, but please no submersion in water, meaning no bathtubs, no swimming, and no hot tubs. again, to prevent any infection.
Right. One caveat to that, though, is our posterior repairs. Some prolapses we will kind of prescribe sitz baths, and so that's a different thing. It's more of just a small pan, kind of much like after childbirth, where you can soak some of those posterior repair or prolapse incisions, but we can give further counseling on that as well. And then we'll talk about bleeding. So most of our surgeries that involve vaginal surgery do have some bleeding. So how much would you expect, Kim?
So depending on the surgery, if it is like a prolapse repair or hysterectomy, the first 24, 48 hours after surgery, some bleeding is to be expected. And that is to be okay. Please call us if you are if you're using a peri pad, you saturate that pad in an hour or less. If any time that you're dizzy, lightheaded, just don't feel well, please let us know right away. Passing large clots, anything like that, just call anytime. You can call 24/7. But bleeding is normal anytime after any of these surgeries. You can see this up to 8 weeks. Should get better every day. Should get lighter. At any time that it would increase or get heavy again, please call us right away.
Yeah, a lot of times I feel like more bleeding. You'll see more with like posterior repair. If you are having non-critical amounts of bleeding, I feel like if you kind of sit with pressure on that posterior vaginal area, it tends to help tamponade some of that, and it goes away pretty quickly. But again, like Kim said, if you have conditions where you're concerned, just give us a call. I'll talk about the pathology. So anytime we take and remove any organs, most of those will be sent to pathology. Those usually take about a week to get back. And so all those will be communicated with you either through the portal at your post-op visit, but all of those will get sent off. And then let's talk about the post-op appointments and visits and kind of when we tend to schedule those.
Yeah, so with the hysterectomy or vaginal vault suspension, some of our larger surgeries, we do a 2-week post-op and then a 6-week post-op visit. 2-week post-op may be with Dr. Beiting or I, and usually virtual. To make it a little easier, you don't have to come into the office at that time. Although if you would like to and you're not comfortable with the virtual, we absolutely will accommodate that, and you can come in. So we usually send a link about 15 minutes prior and ask you to join us online with that. It is very easy to use, but again, if it does not work, we can find another means to do that appointment. And then the 6-week to 8-week appointment after we'll be in the office with Dr. Beiting so that she can do an exam.
Yeah, during that exam, that's when I do the final testing up in the vaginal vault to check and make sure all the final healing has occurred. Just to see, sometimes you're completely healed by that time. Sometimes there's still a few weeks or a little bit of extra time needed. So usually of not too much concern. But after that appointment, too, is when we release you to full activity, typically. If it's not quite ready yet, we'll schedule a return appointment after that as well. So we do just invite you also to share these instructions with your family members. It's really important that they understand the restrictions. I know as women, we tend to take care of everyone else around.
Tend to overdo it, don't
yes, we do overdo it. I feel like this is your time to take a little bit of extra time and heal. So, what are some kind of precautions and when they should maybe call the office?
Oh, yeah. So we do have a triage nurse, and I'm also in the back with Dr. Beiting. So we are in the office every day, Monday through Friday, 8 to 4:30. So please call. Again, the portal is for non-medical questions, and if you're post-op, we really want to hear from you. And that way we will be able to get to your needs much quicker. But we would love for you to call us if you have any concerns, any questions at any time. If any time you experience a fever, especially anything greater than 100.4, please give us a call. Excessive, heavy, prolonged bleeding. You've applied pressure. It's not relieving the bleeding. Please let us know. Vaginal itching, odor, discharge. Please let us know. It is not uncommon, of course, to have discomfort, pain in your surgical area, but if you were to get pain elsewhere, like maybe on one side in your back or just in a different place that you've not had or something new and very different, please give us a call.
Yeah, in general, I think that most of the time the pain does get better. I think the first few days you have a lot of gas pains, and that's just a generalized fullness and discomfort. But usually within 2 to 3 days, and definitely by a week out, most of that should be getting better. So I do feel like maybe most complications, if you notice things getting worse at a week versus better, that's probably better to give us a call instead of waiting on those.
Any trouble having a bowel movement? Like if it's been 3-4 days, you're trying everything, you've done everything that we've suggested, and you cannot have a bowel movement, please give us a call. We'll give you some other things to try. Unable to void fully, you don't feel like you're fully emptying.
Right.
notice any odor or blood in the urine, please give us a call.
Right. It's not uncommon for urinary tract infections after surgery, just with the nature of the type of surgeries we do. So those are things that are pretty easy to check in the office. So, well, we thank you for your time. We hope we were able to answer any questions. And we just look forward to taking great care of you.